Swabach test is also known as absolute bone conduction test. It is a tuning fork test. So before going to introduction, I'll be describing how the absolute bone conduction test. Again, we will explain the procedure to the patient. First, we charge the tuning fork here and keep it, close the external auditory canal of the patient and keep it over the mastoid bone. Here we are checking the bone conduction. That's why it's called absolute bone conduction test. Here, when patient stops hearing, the same vibratory tuning fork is placed over the examiner mastoid bone. If still the examiner is hearing, then the absolute bone conduction test is decreased in patients. If the examiner is not hearing, then the absolute bone conduction hearing is normal in patient. So prerequisite of the absolute bone conduction is that hearing should be normal in examiner. Coming to Swabach test, the author was Lawson Swabach year in 1890, and the principle is based on the principle that the examiner should have normal hearing. And the placement is mastoid process, and the instructions given by the clinician to the patient was the clinician instruct patient to sit in a comfort position. Explain how test is performed. Any spectacles is there, remove the spectacles, no oil. If oil is there, the tuning fork will be slippery. Because of the tuning vibrations will be dispersed. Once a popular test, but nowadays it's not recognized. It compares the patient hearing with that of examiner hearing, in which examiner will have a normal hearing to compare to that of patient. Was set into vibration and the stem was placed against the mastoid process of the patient and the examiner, and here the meters is not closed. The vibratory energy of the tines of the fork is decreases over time, making the tone softer. The patient should indicate whether the tone is heard or not at each time. When the patient no longer hears the tone, examiner immediately place the stem behind his or her own ear, and the patient no longer hears the tone, the examiner immediately place the stem behind his or her own ear, and using watch note the number of seconds the tone is audible after patient stopped it. It means clinician compares even the time what the patient heard the sound and the clinician heard the sound. Coming to interpretation of the Swabach test, interpretation is two types. One is normal Swabach test and one is dimensional Swabach test. Coming to normal Swabach test, both patient and examiner will stop hearing the tone at approximately the same time, which indicates the patient is having normal BC. It means that Swabach test is for bone conduction. In the dimensional Swabach test, patient has stopped hearing much sooner than the examiner. That indicates patient is having impaired bone conduction or in cases of sensory neural hearing loss. Coming to absolute bone conduction test, the absolute bone conduction test, that is ABC test, it is a modification test of Swabach test. In this test, patient BC is compared with that of examiner BC. That is talk about difference now. Here, external auditory canal or meters is occluded, whereas in Swabach test, the external auditory canal or meters is not occluded. So to prevent ambient noise that is entered through the AC, it means air conduction route. So it is also like a Swabach test. The procedure of this test is similar to the Swabach test. It means the patient hearing comparing to the examiner hearing. Coming to interpretation of ABC test. So an ABC test, we are comparing the patient BC with that of an examiner BC. Now as we know, the BC is the measure of cochlear function. So if patient is having a conductive hearing loss, that is his AC is affected, then the patient and the examiner will hear the tone same duration of time. Because the cochlear function of the patient is normal in conductive hearing loss, so there will be no effect on BC. So that the patient and the examiner will hear the tuning fork at the same duration of the time. However, the patient is having sensory neural hearing loss, that means cochlear function or neural function is reduced. In such patients, BC will be decreased, so that the patients will hear the tuning fork for a shorter duration of time. Two advantages of Swabach test. It is a simple and quick, easy test that can be performed. No equipment cost, unlike advanced audiological test. And it is useful for preliminary screening test to know rough idea about the hearing loss. It is also done for bedside application, bedside patient without any support. And it is also done for the uncooperative patients. Coming to disadvantages of Swabach test, it depends upon the examiner hearing one, and subjective test relays the patient response. It is not a quantitative. The test does not measure the degree of hearing loss. It will give us a general idea, and it is a less accurate, and it is a less accurate, and it is rarely used in modern practices, and it cannot differentiate the mixed hearing loss.